Welcome everyone to this Settle in Life session. My name is Dr. Soma Yusufi and I'm a consultant with the National Resource Center for Refugees, Immigrants and Migrants. We are partnering with the Settle In to offer a 2-part series on healthcare in the US. Please remember when commenting during this live session that this event is not private. Please do not share any personal or confidential information. In today's session, we will give a general overview of the different healthcare providers and services in the United States. In part 2, next week, we will explain what to do when you have a healthcare emergency and calling 911. There are many different types of healthcare services in the United States. Some common types of health services include primary care, preventative care, and follow-up care. If you need specialized care, you may need to seek a specialist. Regardless of which healthcare provider you choose, healthcare in the United States can be expensive. It's important to know what kind of health insurance you have and be connected to a clinic or provider who takes your insurance. If you do not have health insurance, it's important to know clinics that can offer a sliding scale or how you might get enrolled in charity care. We will not cover information about health insurance in this live event series, but if you have questions about health insurance, please direct messages or leave a comment on this video. Medical professionals. Let's start with the types of medical professionals. Most people are familiar with doctors and nurses, but there are a few other types of health care professionals that are important to talk about. Nurse practitioners. These are nurses who receive additional training and qualification and perform many of the same functions as a doctor, like providing care and prescribing medicine. They often partner with doctors and may oversee their work. Physician assistant. A physician assistant performs many of the same functions of a doctor, like providing care and prescribing medicine. However, they always work under the supervision of a doctor. Medical assistant. A medical assistant is someone who works alongside a medical professional, like a doctor or nurse. They often collect medical information and do things like take blood pressure, weight, or drawing blood. Pharmacist. A pharmacist is someone who dispenses medication and gives information to people on how to use them correctly. When someone goes to a routine healthcare appointment, they may see many types of medical professionals. They may check in at the front desk, have a medical assistant ask them initial questions and take their blood pressure, then be seen by a doctor who provides them a prescription that they take to a pharmacist to get medication. Now let's talk about where people get their care. Primary care clinics. Let's start with primary care. Primary care clinics provides routine medical care including preventative care and follow-up care, which we will talk about later. This is usually where people have their health home, meaning that they have a regular doctor. Primary care clinics treat people of all ages. People go to primary care clinics for things like getting a yearly checkup, getting vaccination, talking to a doctor about health worry, or when they feel ill. Primary care clinics treat most chronic conditions like diabetes or high blood pressure. Primary care clinics also provide sexual and reproductive health care. Sometimes primary care clinics have pharmacies, dentists, and even eye doctor in their clinic. Sometimes they don't have, and people have to go to other places for these services. Hospitals. Hospitals are for special problems requiring testing or surgery, or for healthcare emergencies. We will talk more about emergencies and emergency rooms in part 2 of this live event series next week. Urgent care clinics. Urgent care clinics provide immediate care for health problems that are not serious enough for an emergency room visit, but cannot wait for a regular primary care appointment. For example, if you have a cough that's not getting better after taking medicine, you may visit an urgent care clinic for treatment. No appointments are required, but it's generally first come, first service, and you usually must wait. Dental and vision clinics. A dental clinic is where someone goes to get routine care for their teeth or when they have a tooth concern like a tooth infection or injury to a tooth. There are two main types of vision clinics or eye clinics in the United States. There are optometry clinics, which do routine eye exams and, if needed, provide a prescription and glasses or contacts. There are also ophthalmology clinics, which provide care when there is an eye concern like cataracts or eye disease. Pharmacies. A pharmacy is where someone goes to get medicine. This medicine may be through a prescription, meaning you need an order from the doctor to get it, or it may be over the counter, meaning you do not need an order from the doctor to get it. If your doctor recommends that you take medicine, the type and amount of medicine will be written on a piece of paper. This is called a prescription. To get your medication, you will go to a pharmacy and give the pharmacist your prescription. Sometimes the doctor may ask which pharmacy you use. Then call in the prescription or send it electronically. In towns and cities in the United States, you will find many pharmacies to fill your prescriptions. Some are small local stores while others are big chain stores with names like CVS, Walgreens, or Rite Aid. Pharmacies can also be found inside some supermarkets. When taking the medication, be sure you follow the direction that will be written on the packaging. Depending on how much medication the doctor prescribes and how long you need to take it, some prescriptions allow refills, meaning you can get more of the same medicine. If you refill your prescription, you will have to go back to a pharmacy. Visit our help center for more information about pharmacies, including tips for overcoming common challenges and what information pharmacies will ask for. Now let's talk about types of medical care. Let's start with primary care, preventative care, and follow-up care. Primary care. Primary care happens at primary care clinics, which we mentioned before. Primary care is a routine and common care for people of all ages in the United States. This includes preventative care like wellness checkups and vaccines. People generally need to make an appointment ahead of time for primary care. Sometimes people can be seen the same day with an appointment, and sometimes they must wait. Preventative care. Preventative care includes routine physical exams with your primary care provider. The goal of preventative care is to find a health issue while it's still early and can be managed more easily. Even if you feel healthy, you should have an annual checkup with your primary care provider once a year. Men, women, and children will have different exams and tests at their annual checkup. For example, women should have an annual well woman exam. You should also have a regular vision and dental exams as well. Follow-up care. Sometimes after a medical appointment, a provider will decide you need more medical care or tests. This is called follow-up care. This can include tests such as X-rays, blood tests, and urine tests. Follow-up care can also include discussion with your healthcare providers about chronic and infection-related health problems, upcoming surgeries, or post-surgical care. If a health situation requires more specialized care, then your primary care provider may refer you to a specialist. Specialty care. Specialists work in one area of medicine. For example, if you have chronic health issues, you may see a doctor that treats the heart, such as a cardiologist. Some specialists treat certain people, like children or the elderly. Others specialize in one part or system of the body, such as the heart or eyes. If you need a specialist, your primary care provider can refer you to one. You should always follow up with any specialist you were referred to. When you visit a specialist, be sure to ask the specialist what type of follow-up care is needed before you leave the office. In some cases, you may have a medical concern or injury and need treatment right away. Let's talk about urgent care and emergency care next. Urgent care is when someone has a medical concern or injury that is not life-threatening, but they need to be seen right away. Often people go to urgent care clinics when they cannot get a timely appointment at their primary care clinics, or they do not have a primary care clinic. For example, their child has a concerning fever and it's the weekend and their primary care clinic is closed. Emergency care. Emergency care is for life-threatening or life-concerning medical concerns or serious injury that needs attention. For example, someone has chest pains and is worried it might be a heart attack. Their child has fallen and broken a bone, or they are pregnant and have sudden bleeding. We will talk about emergency care including 911 and ambulances in part 2 next week. Today's session covered the different types of healthcare and healthcare providers in the United States. In part 2 next week, we will talk about emergency care and calling 911. We will post a link to that event invite in the comments so that you don't forget to attend. For more information on patient rights and responsibilities, how to get interpretation, TB, latent TB, and more health-related topics, check out the Help Center. I would like to thank you for joining us for this Settle in Life event. We covered a lot of information. You can return to this recording after the event to review the information again. We will also encourage you to follow the Settle in Facebook page for the latest information you need to know as you adjust to your life in the United States.